Greetings, everyone, and welcome to the Florida Mental Health Counselors Association webinar entitled Distance Counseling in Florida, the 7th webinar for our 2018 Emerging Issues in Mental Health Counseling webinar series. My name is Aaron Norton, and I'm the chair of FMHCA's Education, Training Standards, and Continuing Education Committee, and I'll be your moderator today. I'm going to start by getting a few housekeeping items out of the way. First, I'd like to familiarize you with the basic tools of our webinar system. You should see, usually on the right side of your screen, a GoToWebinar control panel. That panel contains several subpanels that give you options for interacting during the webinar, such as questions, chat, and handouts. If at any time you want to use one of those options, just click on the triangle on the left side of that menu option, and the menu option will expand. Now we're going to cover how you'll ask questions today because all of you are automatically muted, so no one will be able to hear you or see you during the webinar. If you want to ask a question, just click on the triangle next to questions on your GoToWebinar control panel. If your question is particularly complex, I might ask you if you'd like to be unmuted, at which time you can verbally ask the question directly through your microphone. It's pretty rare for an attendee to experience technical problems, but if you do, just enter that problem into your questions panel and out with it. At the end of today's webinar, you'll see a webinar evaluation form populate on your screen. Please complete those questions because your responses will be very helpful feedback to us. And although we ask that all attendees complete that evaluation form, it's particularly critical for those who want CEUs, as we'll be unable to award CEUs to anyone who's not completed the survey. If for any reason you miss that evaluation form on your screen, you'll still have an opportunity to complete it, and the follow-up email we'll send you an hour after today's webinar. But please complete that form today because we are required to enter your attendance into CE Broker tonight. We will be recording today's webinar and placing it on our FMHCA YouTube channel for our members to view, and your presenter has shared with us a link that you can use to view her slides at your leisure. Now, I tried to upload that link into our handouts panel. It didn't work out so well, so here's how you can access it. If you click on the triangle next to the word chat on your control panel, then you'll see that I've posted a comment with that link to that presentation there. So that will be your way to access that link if you would like it. Now, I'd like to collect some information about you, our audience, for our presenter by launching some polling questions. For those of you who have done webinars with us before, you kind of know the routine with these questions. Everyone except for our presenter should right now on their screen see a quick poll that asks the question, which of the following describes you? And you can select all that apply, so you have multiple options. You can choose licensed mental health professional, registered intern, counseling student, counselor educator, or other. So I will give you all a moment to select all of these identities that apply to you. Looks like 91% of you have chimed in. We'll give you just a moment longer. And we will go ahead and close this polling question out with 94% of you having responded and share our results. Looks like 78% of you are licensed professionals, 9% registered interns, 6% counseling students, 3% counselor educators, and then 6% other. So we'll go ahead and launch a second polling question. This polling question is going to deal with our learning objectives today. Which of the following learning objectives are you most interested in? 1, describe ethical and legal distance counseling practices. 2, discuss HIPAA and HITECH regulations for distance counseling. Or 3, explain the benefits of distance counseling. I'll give you a moment to take a look at those 3 learning objectives for today's webinar and make your selection on which one you are most interested in hearing about today. About 70% of you have responded, but I'll give you a moment longer to chime in. And I think we'll go ahead and close out with 86% of you having participated in that polling question. So 71% of you were most interested in the ethical and legal distance counseling practices, and 29% of you were interested in the HIPAA and HITECH regulations for distance counseling. Nobody actually selected explaining the benefits of distance counseling. All right, so without further ado, I'm going to introduce today's presenter. Dr. Tanya Johnson is a private practice owner with a doctorate in counseling, and she teaches at the University of Seattle. She's been practicing distance counseling for the past 4 years. She's conducted research and presentations regionally and nationally on technology and counseling, and co-wrote a curriculum leading to the Distance Certified Counselor Credential approved by CCE Global. Additionally, she's going to be telling you about an app that she is developing with applications in our field. So ladies and gentlemen, please welcome Dr. Tanya Johnson.
Hi, everybody. Nice to be with you today. Interesting that nobody wants to know about the benefits of online counseling. I'm guessing that means that we're already convinced that it's the next thing that the next direction for our field. So this is a topic that I have done a lot of presenting on. So please go ahead and type questions into the chat box as we go. And if anything seems urgent, we need some clarification questions, we can go ahead and stop and go. I like to do presentations kind of as a discussion style, which makes things a little bit harder on a webinar, but we'll do our best. So Aaron already introduced me, but there's a little recap of my thing. I have a lot of letters behind my name. I'll be explaining about the credentialing, the DCC credential, in a little bit. So to jump right in, what we're going to be discussing today is different ways that we can use technology in counseling. There's a lot of ways that technology informs and expands the way that we communicate with clients, potential clients, and colleagues now. And so that means infinitely more ways to violate HIPAA, but it's not as scary as it seems. We'll also talk about the laws and ethics around technology and counseling in Florida in particular, and on the national level, and how HIPAA regulations apply to distance counseling in particular, and those other ways of communicating, and also how distance counseling is going in our field. So I thought we could start there with our settings for distance counseling. I'm guessing that a lot of people mostly have interest in applying distance counseling within private practice, expanding your client base to include distance counseling. Another way that a lot of clinicians are getting into private practice distance counseling is through apps like BetterHelp and Talkspace, which I have mixed feelings about. We can talk about that one later. Another common application is rural areas, rural health agencies. I'm aware of programs here in Washington and in Alaska that expand mental health services, particularly access to psychiatrists and medication management through distance counseling, so that can using technology like this can bring access to areas that usually would only have a psychiatrist visit once a year, if anything at all. And counseling can become part of that as well. Crisis stabilization units and hospitals are starting to use distance counseling. I'm aware of a program in Broward County with a HCA hospital, I believe it's University Hospital, that launched a program to use distance counseling or telehealth methods to speed up the assessment process for patients to go from, say, the emergency room into the psychiatric unit. So rather than waiting for the psychiatrist to physically come to the hospital, do the rounds, and do the assessments, they can bring a computer monitor or one of those computer on wheels that you see in the hospital to the patient's bedside, and then a licensed clinician who's in a separate location can conduct the assessment and make the determination whether the patient should go to the psychiatric unit or be discharged. It speeds up the whole process. And there's a lot of exciting developments with community mental health centers. Oh, I don't know if any of you had the experience of doing in-home therapy as an intern or as a registered intern. But I think that's an untapped area where in the future we'll probably see technology be able to bridge some of those gaps and expand services. So how does distance counseling work? There's a number of things to keep in mind. I Most of the time when we're talking about distance counseling, we're talking about synchronous, which means we're all online at the same time. Like right now, we're doing some synchronous technology assisted communication. There's also asynchronous, which means that it's not you're not online at the same time. So that would be more like emails or sending a message that you answer later. But for the purpose of this webinar, we're going to mostly be talking about synchronous, so being online at the same time. I like to think of the considerations in these two different aspects, clinical and logistical. So with clinical considerations, we need to, within private practice, we need to think about which clients are appropriate for online counseling and how do we screen for appropriateness. For my own practice, typically what's worked well is asking the client, are you comfortable with the idea of online counseling? If they're comfortable with the idea and they feel comfortable handling the software and managing technology glitches, knowing what to do if the internet goes out, um, that's usually been fine. And then the other aspect you need to think about is there the likelihood that they might need crisis work. So, and we'll talk about that a little bit. Florida has some specific laws around crisis and telemental health or distance counseling. But for the most part, I think we as clinicians would feel better about having our higher risk clients be in a physical office space with a clinician rather than be in an online setting. Handling technology glitches is something we need to think ahead about. And like I mentioned, if heaven forbid you have to manage an involuntary commitment or handle a crisis via distance somehow, it's just thinking ahead. How are we going to do this? Making sure that you've gathered all the information from your clients, their physical location, emergency contacts, and verifying their identity when they get online. Logistically, we need to make sure you have the right kind of software. That's the HIPAA secure concepts we're going to be talking about. And again, screening clients for their ability to interface with you through software. Then there's the things like collecting signatures and payments electronically, which there's a lot of software programs out there that can make that very easy. And a lot of these things are actually built into electronic health record systems like Simple Practice or Therapy Notes or Counsel, whichever you may be using for your private practice. A lot of those have the ability to take payments remotely and do electronic signatures. It's also important to have a tech failure protocol. So that means that you have thought through all of the steps of everything that might go wrong. So if the internet goes out, if it's just completely jumpy and you can't understand each other, how are we going to manage that? How are we going to maintain the therapeutic relationship and get the session done? So the way that usually looks for me, is if within the first 15 minutes or so, if there's a lot of technology problems, I'll probably ask to reschedule. If it's within, as we get going, if there's one of those little bumps in the connection, I just redirect back to, summarizing what was last said and just kind of jump back into that. Seems to minimize the disruption, and we can just get back into the session. If there's a significant disruption near the very end of the session, I'll typically call the client or text them and finish the session over the phone if needed, if we can't rectify the situation. And it's important to have that crisis protocol set out, and even as part of your informed consent, so that your client understands that if they worst case scenario I can think of, which has never happened to me, is that the client verbalizes some suicidal ideation or tells you about something else that would require some mandatory reporting, and then disconnects and doesn't answer the phone again. So then, having had a crisis protocol created in the first place, they'll know and have agreed to how you're going to proceed from there, which might include contacting their emergency contact, depending on what they said, maybe initiating a Baker Act. Getting insurance to cover has been a lot easier lately in Florida. A lot of insurance companies are really getting on board with telemental health, and a lot of times all you need to do is put a 2 in the location box on your billing form. So instead of 11, which is office, you put O2 for telehealth, and that typically is all you need to do in order for insurance to cover. But it's always best to call any insurance companies that you're paneled with and make sure that they don't have any other requirements for you. So with more about crisis
Before you
situations.
go there, Dr. Johnson,
Sure.
sorry to interrupt, but
No
we
problem.
have a request from one of our members I thought I'd let you know about. They're wondering if you'd be able to expand your Prezi view by clicking on those 2 arrows in the lower right-hand corner. So it puts it into full screen mode, I guess.
Sure. Yeah, let me do that so you guys can see it better. It was hidden under the GoToWebinar thing. How's that?
Ah,
Better?
so far I don't notice anything different. Oh, there it is.
Good.
Now it's coming through. Okay, great. Thank you.
Yeah, no problem. Thank you. Um, so crisis situations are, I think, what gives most counselors pause about doing distance counseling, because it feels like an insurmountable task if a client were to express some suicidal ideation. What do we do? When I first started this work, it was comforting to me to know that telephone crisis lines, have been around since 1953. So there is a lot of research and a lot of precedent for managing crises from different locations. Using a crisis protocol is the most important part. Just having a plan, what to do if the client expresses suicidal ideation, if you have a disconnect in the middle of a conversation like this, just having some backup communication, call on the phone. If you do have a client who is higher risk, you can gather even more information, maybe their preferred psychiatrist, their preferred crisis stabilization unit. Definitely important to know your client's location. So that means even if you do an intake, excuse me, via distance, get their driver's license. Make sure you have a physical address, not a PO box, and know that because it's distance, they might be in a different place from session to session. So if you notice that their background looks a little different, or maybe just ask them every session, hey, are you at home? Are you at work? Sometimes people continue their counseling sessions when they're traveling, so maybe you can ask, which hotel are you at? Just to be sure that you would know, in the worst case scenario, where to send emergency services. In nearly 5-6 years now of me practicing this way, I've never had to initiate a crisis protocol, but better safe than sorry. And make sure that you follow the most stringent applicable laws and ethics. If you and your client are in different locations, and what that means, we'll talk a little bit more about how Florida is still developing a lot of the laws and regulations around telemental health, which means that we default go to the existing ethics and guidelines on the national level. And we'll get into more of that a little later. So some of the disadvantages of distance counseling is that clients report that some issues are easier to hide with online counseling. Obviously, there's less of the nonverbal interaction that we can see, and it can be difficult for clients, say, with a gaming addiction or some other addictive behavior related to being on the computer. Is probably not a great idea to encourage treatment through technology that way. In my experience, couples counseling is particularly difficult without the physical space to navigate and enhance the communication skills. But I'm aware of a lot of clinicians who successfully do couples and even family therapy where families and the couples are all in different locations. Um, Disruptions in internet connection can obviously disrupt rapport if you have significant um, internet problems, or which can be either on your end or on the client's end. So sometimes that's completely out of your control. That can disrupt rapport and sometimes make the distance counseling modality impossible. And the biggest limitation is that this is only the service is only accessible to clients with the means for purchasing a computer and having a fast internet connection. I'm hopeful that in the future, organizations like community mental health centers will perhaps use tablets or other technology in order to bridge that gap. One way that can be used is to have a receiving site or an origination facility. So this is what happens in rural areas a lot. If a client doesn't have their own computer equipment, they can go, say, to the local health clinic, and they'll have a computer set up to be able to connect them to the psychiatrist or the counselor who's in a different location. Effectiveness, however, has been studied and found to be as effective as face-to-face counseling for a lot of different issues, including addiction, depression, and anxiety. And there continues to be a lot of exciting research about how how online counseling can increase access to treatment for these common issues. Clients also really appreciate the flexibility in scheduling, being able to do counseling from home. Um, and the sense of anonymity, not being in a counselor's office, can actually facilitate self-disclosure. Um, I think there's a lot to be said about having your client be able to connect from their bedroom. There's they're in a safe environment, their own space, and I think this can really facilitate self-disclosure. Um, so increases access to services. I've certainly had clients who otherwise would not have been able to seek counseling, or have never seen a counselor before, and are more comfortable reaching out to me because I can, help them maintain that safe distance through technology, and they can start their treatment. Another surprising advantage I've seen is I've had clients who are parents, and with distance counseling, they don't have to worry about getting childcare because they can have their toddler sitting in the same room and attend to them while they're on the computer having their session. Counselors also have less overhead costs and flexibility in scheduling, and so like I'm at home right now, and since I'm living in Seattle right now, I see my clients in Florida from home. I don't have to have an office. I don't have to pay for that overhead space. And I find that it's helpful to have that little box in the corner of your own face to make sure that you keep that therapist face. Before we move into HIPAA, anybody have any questions about that section about how distance counseling works?
So far, I don't see any questions entered in the panel other than some technical questions that we've already answered. But folks, if you do have a question, go ahead and type in. Somebody is asking if we'll be getting written materials on what we're covering. So folks, what the presenter has done, if you didn't hear earlier, link to all of the slides that you see right now, you'll be able to access your browser using that link. And if you haven't found it yet, you'll find it at the chat option. So on your GoToWebinar control panel, you'll see a little triangle on the left-hand side of the word chat. Click on that triangle, and then you will see that I've entered in the link for accessing these slides. Looks like we do have at least one person saying that they're also getting some feedback. I wonder if anybody else is having some feedback issues or not.
Yeah, and I was hearing some feedback there as you were talking before.
Yeah, it looks like they're getting feedback from me. So I'm going to try and use a different mic In a moment, I'll switch over and we'll see if that takes care of the issue.
Okay, so I'll just going into HIPAA, and just to address the materials, I do have some links are embedded in the presentation. So if you want to click into the presentation, you can find some links. There's also a references section. So there's a number of materials there to continue some reading. So HIPAA, we're all familiar with in one way or another, because this is applies to any setting that we work in to be able to protect the confidentiality of our clients. So HIPAA applies specifically to protected health information called PHI, which is the client's basic information: name, date of birth, social security number, address, diagnosis, treatment dates, things like that. The one thing that's important to know that HIPAA does not apply to financial information. And so when you're choosing, say you're choosing some software in order to be able to take payments from clients for online sessions, that does not have to be a HIPAA secure program, because that financial information in particular is exempt from HIPAA. The laws have been updated and expanded as technology laws have changed. HIPAA particularly, and then HITECH is the part that expanded HIPAA, so kind of updated some of the fees and fines for HIPAA breaches, and talks a little bit more about using software and the way that we communicate electronically. HIPAA is the Healthcare Information Privacy and Accountability Act. So we're looking at two different aspects: the accountability and portability. So accountability is that privacy aspect. So if you have paper files, you don't leave them out with names easily visible. You shred documents instead of throwing them away that have PHI on them. You don't leave schedules out on the table for people to see, because then that would reveal all of your clients' names. And paper files need to be signed to locks when the office is closed. So that would be a locked filing cabinet and a locked office, things like that. And the portability aspect is what applies more to distance counseling. That you use HIPAA secure software, which uses end-to-end encryption. We're going to talk about what that is. And also that you have passwords on your phones and computers. So if you use your cell phone, you use your computer to communicate with your clients, you need to make sure that those, say you were to lose your phone or your computer, you want to make sure that you have strong enough passwords that they wouldn't potentially be broken into easily and have your client's PHI breached. And so what I do with my cell phone is I have the fingerprint password enabled, and my computer has the password login as well to keep that safe. So a little bit more about what HIPAA secure software looks like. End-to-end encryption is probably something you guys have heard before. So this little graphic kind of explains what end-to-end encryption is. So sender, say that's you, and the recipient is your client here on the other end. And if you're using end-to-end encryption, then on the way from your computer to your client's computer, the information is encrypted or protected, so that, say, a hacker or somebody were trying to intercept that information, it wouldn't be readable. It's like it gets jumbled up on the way to the other computer, and only the recipient can unjumble it to be able to receive that. So that said, the different ways that we communicate with our clients all have to we have to be aware of our HIPAA secure software. So things like text messaging, where a lot of clients prefer to text. A lot of even younger people don't want to make phone calls anymore. We like to just text and send emails. So it's important to know that things like iMessage and most of the text applications that come on your phone are not HIPAA secure, so they shouldn't be used to send PHI. Now, there are a lot of secure messaging programs through electronic health records, EHRs. such as I use Simple Practice, for example. It has a messaging application. And there's also other text apps like Tiger Text and HIPAA, which are used in other settings. Like Memorial Regional Hospital uses Tiger Text for clinicians to be able to send text messages to each other. What makes that one interesting is it automatically deletes all of your messages after 30 days. The issue that I see there is that you have to ask the client to use a separate application to communicate with you. And a lot of times they're not going to do that. And so the other option there is to put in your informed consent that if the client chooses to communicate with you outside of a HIPAA secure setting, that they understand the risks, that information could be compromised. Video conferencing is the way that I usually conduct distance counseling, and this one is tricky. We usually talk about Skype. We use Skype as the term, like we use Google as a verb. Let's Skype or let's FaceTime later. But those programs are actually not HIPAA secure, so you don't want to use those for online counseling sessions. HIPAA secure software that is typically used for distance counseling is Zoom, Uvu, VC, and Doxy. So I use Doxy because I like that it's a browser-based program and it's free. Zoom, you do have to pay for the use of that software, but it has a lot more features. Doxy.me is the website that I like to use. It's the most simple one, I think. It's specifically for telehealth, and so it is a HIPAA secure program, and it doesn't require any sort of a download. So you don't have to download a program and make an account. You just create your account online, and then you can send a link to your client, and that's how they connect into the session with you. Let's see, our organizers experiencing technical difficulties. All right, well, let's just keep going. Email is another common way that we interact with our clients. Oh, so our typical email hosts like Gmail, Yahoo, and Hotmail are not HIPAA secure. A lot of healthcare companies, though, use automatic encryption. So if you're on your Outlook at work, say through a hospital or an agency, most of the time those are going to be automatically encrypted. Every email that you send will be encrypted. And other options typically do have a monthly subscription fee, like G Suite, the professional Google accounts are what I use, or Hushmail. And if you do a Google search for HIPAA secure email, you'll find a lot of other options. So our laws and ethics in Florida are a little bit tricky. Florida does not have any telehealth parity laws right now. And telehealth parity laws, which exist in a lot of other states, are laws that require that insurance companies reimburse for telehealth visits at the same rate and for the same purposes that they would for an in-person visit. So basically that means that if an insurance, say you have, Florida Blue, and they do cover mental health sessions, they say at 90834, they have to cover that same service via telehealth or distance counseling. So Florida doesn't have any of those particular laws right now, but they're working on it. If you guys have visited the 491 website in the past couple of years, you've probably seen that they were asking for survey information and wanting to gather information. That's the beginning process of creating specific laws and regulations for Florida. The 491 board doesn't provide any guidelines on ethical distance counseling. The word computer and technology are not found in the statutes for Florida 491. But some other aspects of Florida have addressed it. So, for example, Medicaid does reimburse for distance counseling. A lot of other insurance providers do as well. And Baker Act evaluations can be done via telehealth. And that's exactly like what I was talking about with the hospital settings that do the psychiatric evaluations. But you can also initiate a Baker Act, and so that can be part of your crisis protocol. Is that you do we do have the legal backing to be able to initiate and carry out a Baker Act even if we haven't physically seen the client. So since we don't have any state regulations, we go to the national level. So the American Counseling Association in the 2014 Ethics Code in Section H addresses distance counseling technology and social media. And so I encourage you to reread that section and get familiar with the guidelines from American Counseling Association. One that's pretty interesting that we don't usually talk about a lot is using social media. And I have this example here from a friend of mine who made a little snafu checking in at an elementary school and talking about a client that she was seeing. Now, this is the type of unwitting HIPAA breach that I see online all the time. It's a positive, this is a great thing that happened today with this client, but it gives a little too much information. We have an exact location and a description and an age of this client. It would be way too easy for, say, a neighbor or a friend of this family to recognize who this person is talking about. And so we just want to be very mindful. And if you had a great day at work, just put had a great day at work. If you had a bad day at work, just had a bad day at work. No specifics. Be very careful with social media, particularly because even if it's a private group, I know there's a lot of private and secret groups, particularly for networking and supporting and getting questions from other professionals. You never know who's in that group, who might screenshot things, send things out, things on the internet. Just never die. So the certification process around distance counseling is also in flux. The credential that I have, the distance certified counselor credential, is being replaced with a board certified telemental health provider certificate through the same organization. So you guys might recognize the Center for Credentialing and Education. It's the same organization that we contacted to take our board exams. And they're in charge of other certifications like the supervisor certifications, and they have some coaching certifications as well. If you're interested in that, I provided the link, that's specific training, and then you can so if this is something that you want to specialize in and really dig into, then I'd encourage you to go further with the training. On the Florida level, there's also an e-therapy certificate that is being updated. Technology is something that moves really quickly, and so right now, if you go to the link about the certified e-therapist, you'll see that they're updating the entire curriculum, and it'll be available again, I think, this fall. So that's another option if you're interested in pursuing a specific certification. So, what questions do we have so far?
All right, so we have a couple questions, and they're kind of related questions. Barbara has asked, do I have to do the counseling from my office in Florida, or can I be in another state?
That's a great question. I am in Washington State, and I see my clients in Florida. Usually the issue is, where is your license and where is your client? So my understanding is that you can be anywhere as long as your license and your client are in the same state.
Okay, so Tanya's asked, can you counsel someone outside your licensure state? I guess that would be a very related question.
Right, yeah, that one is also tricky. So it depends. It depends on where your client is located. A lot of states are developing processes to um, get like a guest license, or you contact their board and they'll approve you to see a client in their state without having to go through their entire licensure process. Other states are more lenient about it. And others are more strict about it, where they say you do. So Florida is one of those where if you're going to see a client located in Florida, you have to be licensed in Florida. Um, and then it comes up internationally as well. So, for example, Bahamas does not have counseling. It doesn't recognize counseling as a profession. It's not regulated. Um, and so that means you can see clients in the Bahamas. You're not breaking any of their laws because there aren't any. But if you were to try to see somebody, say, located in England, they do have a counseling profession, or Canada, and so you would be subject to their laws about distance counseling. So it depends.
Yeah, I've always heard as a the appropriate practice is to contact the state or country in some cases that your
Mhm.
client's physically in to verify or get permission from them, from their board, on whether you can do the session. Problem is, I had a client one time who was going to Massachusetts for college, and I couldn't get their board to ever call me back. And I had a
Mhm.
colleague who had a client in Texas, was leaving Texas for a few months for something work related. And Texas told her, no, unless you have a license here in Texas, we don't care where you're at. If your
Mhm.
client is physically in our borders, you cannot provide
Mhm.
distance counseling here.
Right. Yeah. So that's one of those instances of how, technology and the way that our profession is organized are a little off right now. The practice of distance counseling is so new that it's going to take a little while for all these laws and regulations kind of to catch up. So for right now, it's kind of a patchwork, and yeah, it depends. So yes, the best practice is to contact the board in the location where your client is.
What
And
One additional question is, I know you showed us the ACA code of ethics, but there's a question of with the American Mental Health Counselors Association Code of Ethics.
Mhm.
In their telehealth section, revised in 2015, it reads, counselors only engage in distance counseling when they are licensed in the state of the client. And people aren't sure, does that mean licensed in the state where the client is a resident, or licensed in the state where the client physically is right now?
Mm,
Because
that,
what,
mhm.
what happens if a client leaves on a vacation or business related trip, and
Mhm.
then they want to do a video session? They're a resident of Florida and the counselor is
Mhm.
licensed in Florida, but they're physically outside of the space of Florida right now.
Uh-huh. Uh-huh. Yeah, that's a great question. Now, AMHCA is focuses a lot on the intersection of insurance companies with our practice. So I'm gonna guess that that's why it's a pretty hard line of you must be licensed in the state where the client is located, because otherwise you're never gonna get um, insurance reimbursement for that session anyway. Now, so keeping that piece in mind, that would be more tied to the client's um, state of residence, because that would be where their insurance plan would be located, and that's where that would be the administrative piece. Now, if a client goes on vacation for it, that's one of those ethical judgment calls. Um, you can check and see what the state's regulation is, where they're currently located, or you can treat it as if they're just on vacation. It's really, it's up to you how stringent you want to be about that.
Yeah, I've heard some of the related issues are you don't really know what the laws are in that state necessarily. So,
Mhm.
has your client disclosed something that would be reportable in that state, or is your client
Right.
is there a Baker Act variation in that state?
Mhm.
And then another issue has been, well, you're sort of crossing state lines providing healthcare now in a
Mhm.
state where you're not licensed to provide healthcare. And
Mhm.
then
Mhm.
another question has been, maybe there are some states where counselors can't diagnose and have some different
Mhm.
restrictions on diagnosing and treating, and now you're
Mhm.
practicing across state lines. So it's gotten kind of fuzzy. And yet there's the
It,
ethical issue of not
yeah.
abandoning your client too when they're on vacation.
Right,
when
right.
they,
Yeah. There's a lot of interacting pieces there that are really difficult to sort out and really kind of yeah, cause us to have to flex our ethical muscles there. That's a good point that yeah, even counseling as a profession is not uniform across states. The regulations and licensing protocols and yeah, if we can diagnose or not, if we can even initiate involuntary commitments or Baker Act type evaluations, that's going to vary from state to state. Yeah. So again, that comes back to um, having appropriate screening of your clients. Hopefully, those type of things won't come up with your typical private practice worried well sort of a client. But it is good to keep all of those possibilities in mind. And if a client is maybe has some more high risk um, issues going on and travels, it might be best to play on the safe side and wait until they're back in the state where you have a license.
Michael has asked the question, is there a list of those states that accept guest licenses?
That is a good question. So, see if I can. I'm going to jump ahead to my references list. That's my app thing. We'll come back to that. References. Um, so on counseling.org, they have the state by state comparison is about licensing requirements. Um, the states that allow guest licensure, I'm not aware of a database for that. That's the other thing about technology and counseling is everything is moving so fast that a lot of times it's difficult to make sure they have up to date information. Um, so I would recommend going on a state by state level there because even if I could share a list of those states, it might be different tomorrow or next week.
That would be a great request for an organization like ACA or AMHCA to
Mm-hmm.
create some kind of listing that's updated every couple of years. Sort of like
Absolutely.
the ACA does put out a guideline that shows us the licensure requirements and licensure portability
Mm-hmm.
and scope of practice from state to state, and they update
Mm-hmm.
it every 2 years. So what if they
Mm-hmm.
added a section on telehealth to that? That would be a really neat thing.
That
We
would
should
be,
request that.
we should. I agree. Yeah, I have that state by state comparison link is right here. Um,
We have two other questions. This question maybe kind of has already been answered. Ken says, I have a client who shares time in Florida, New York, and California. I can do telecounseling regardless of what state they're in at that time, he's asking. And I guess
oh,
that, again, that's complicated. And maybe a start would be that he would contact the licensure boards in New York and California to
mm-hmm.
see if they're cool with him doing that, maybe.
Yes, you would do that for sure. It's tricky because you have these three different aspects uh, of that. There's the legal standpoint. Um, does the state have any legal guidelines in particular that say yes or no, that draw a specific line there? No. Um, and and then does the state have any ethical guidelines about whether or not that's allowed? And then if you're billing insurance, are they going to allow you to bill for that session? Um, so, for example, in Florida, legally, there are no guidelines. And so if we had if we had somebody that say was licensed in New York and they have somebody who comes down to Florida, Florida doesn't have anything in particular saying no, you can't, or yes, you can. It's just up in the air. They're in the process of examining what our telehealth regulations are going to be. So it's just this big, vast gray area right now. Do we have any other questions?
Oh yeah, sorry. I was actually just asking one, but I forgot to
Oh,
unmute myself first.
oh, okay.
So we have a couple more that have come in. So Tanya has said, I am counseling a client who is a Florida resident and is presently in Rhode Island. I looked up the laws there, and distance counseling does not include telephone counseling, just counseling using some type of visual software during the session. So I guess that's more a comment for our awareness that there are states that don't, that phone appointments aren't considered part of their distance counseling policy.
Yeah, which is interesting because there are other states that require a level of training on telehealth practices, even for telephone therapy. Um,
Mm,
even Arkansas comes to mind as one state that requires that any clinician using any sort of telehealth technology have training, documented training. Um, Now, telephone counseling, I don't know. I agree with that kind of a regulation because um, with video conferencing, you at least get the nonverbal, you at least get some visual. Phone counseling, maybe that's just me. I don't like it.
yeah, I think the other questions are again about the slides, so I'll respond to those people
Mhm,
individually. And
mhm.
I think that's it for now for questions.
Okay, great. So I do want to. Oh, I need to go all the way through here again to my information. I do want to share information about my app, which is funny because it's the kind of the opposite of distance counseling. So what I'm in the process of developing here, sorry for making you all dizzy with the going through the slides again, um, is think of it like Airbnb for office space for just for therapists. So I've called it TheraSpace. I have a beta version all ready to go. So being able to put up your office as a listing, and you can rent rooms out to other clinicians, and by the hour, by the day, by the week. I'm hoping this will be, a way to have some office shares for new clinicians who want to get into private practice, being able to connect with more established clinicians who have office space available. Because I know this has always been a really difficult thing for me um, as I ventured into the world of private practice. So just a few screenshots to explain how it works. This is a sample listing for an office space. You could select a particular room and book it. Obviously, 125 for an hour in a room is a lot, but this is all just placeholder text. Um, the booking request goes to a host. Host receives the booking request and can approve or decline it, and payment goes through right on the app. Um, so I am recruiting beta testers right now, which means that I would send you a copy of the app for free and just ask for your feedback so that we can refine it and make it ready for to put up on the App Store. So since all of you are interested in doing online counseling, hopefully that means that you will have some extra time that your office is available, and maybe you can use this app to find some new subleasers and be able to make your office go to work for you. Or if you were on the other side of that, you need to find an office space to start seeing clients, then that's my hope is that this can be a way to connect people with offices with people who need offices, and just for therapists. So that's my whole thing. This always happens. I'm a very concise presenter. So I'm happy to take more questions and make sure everybody feels comfortable with this stuff.
This is one of those topics in which people tend to have a lot of questions. So, folks, why don't you start submitting your questions? And also, if any of you have any experiences involving telehealth
Mhm.
that you think would be a helpful contribution, then I can also, if you enter some information in the questions panel, I can unmute you and allow you to tell us a little bit about it if you like. Sort of like the colleague I had with situation with Texas, and my own experience with Massachusetts, trying to get approval to do video sessions with a client who went to college there and then wasn't able to get any response from their board. So what questions do you guys have? Okay, so here's our next question from Peggy. Are you aware of any practice management or electronic health record platforms that cover all aspects of communication?
Sure. So most of the EHRs um, have most of these. A lot of times they won't include email. So the one that I use is Simple Practice, and they do have the scheduling piece. They just included a video conferencing piece so that you can log right into the program and connect with your client within Simple Practice. They also have the secure messaging. The only one that is not included, I believe, is email. Therapy notes would be another one to look at. Now that's I would recommend you can do side-by-side comparisons of all these different software programs through Capterra.com. So let me, since you're looking at my screen, may as well.
I know Therapy Notes does not currently have any kind of video platform. So I use Therapy Notes, but then I use Doxy for the video part because it's free anyway and really easy to use, and it's HIPAA compliant, just like you use that one. I know there are some like Counsel, COUNSOL, incorporates both the email messaging and the webcam, but unfortunately it doesn't let you bill insurance companies or submit claims, and it doesn't accommodate groups. So it seems like
yeah, it really depends on what you need for your particular practice. Yeah. Capterra, like here, I used to use counsel.com. They have since updated to include the insurance billing as part of it. But yeah, they still don't accommodate groups. And when I used their encrypted email server, what I found is that clients don't go and open those emails because it's too many steps. Because you have to log in and enter the password, and it's harder than just reading your email. And so that's why I have included in my informed consent just kind of a permission. I have an extra spot for them to initial saying I give permission for you to email me or text me outside of HIPAA secure environments.
I've never been able to find one practice management system that does everything that I want. They all have bits and pieces.
Yeah, they're all bits and pieces. So you really have to kind of think about what it is that you need, your particular client needs, and try to match that.
So, and what website is this again that you're using to compare Capterra?
Yeah, this is Capterra.
Okay.
And
Great.
so you can.
Now, another question. Oh, go ahead. And another question comes from Angelica. She has asked if you can talk a little about BetterHelp and Talkspace.
Sure, yes. So BetterHelp and Talkspace are these apps that have been developed to make distance counseling more accessible, and so they're very user focused. You can so the idea is that the client can just log in and be matched to a therapist immediately and get help right away. So it's great on the accessibility front. From the counselor end, it's a little bit more complex. My experience with BetterHelp was several years ago. I know that they have updated their practice since then to include more video time. BetterHelp does asynchronous and synchronous counseling, so you can do either just email messages back and forth to your client, or you can also schedule video sessions. And there's different tiers of subscriptions that the client can select. The issue that I had with them and that I've heard continues with a lot of other counselors is that the reimbursement rates are quite low. Um, and um, the ethical pieces are a little bit sketchy. So sometimes you get matched with people outside of your state. In my experience, I had clients who obviously entered fake names, so I did not have enough information to be able to do any mandatory reporting if I had to without breaching confidentiality and talking with the administration of the program. Um, the other issue that I've heard about from therapists who use these platforms is that because they're a business and it's an app, they're focused on maintaining clients. So that means that with other programs such as Seven Cups of Tea or other, I've heard directly from clinicians that they are encouraged to keep clients on their caseload even if the clinician has deemed them ready for termination. So there's some more ethical issues there. Um, with Talkspace, they talk such a good game. I started the onboarding process with Talkspace. Um, the which they're talking. I mean, even on this website, Therapy for All, 1 million people already feel happier. The issue with Talkspace is that it only exists on iOS. It's only an Apple product. So I wasn't able to even start working with them as a clinician because I use an Android phone. Um, and I have an issue with that because most people who need increased access to healthcare don't have iPhones. And again, it's a business, and they're looking, they want people to maintain their caseloads. So there's some conflicts there. It's interesting to watch the industry try to work itself out, and I think this is part of the growing pains.
Okay, we have a lot of questions actually. The next one is from Michael, and Michael says that he just transitioned to private practice and he's looking for good ways to advertise throughout the state. He's in Central Florida.
Mm-hmm, mm-hmm. So, advertising for online counseling for private practice is a little bit tricky. Um, in my experience, the best way to stand out is to have a particular niche. Um, the public clients are starting to become aware of online counseling as an option, but a lot of people still prefer to go to an in-person counselor. So thinking from the perspective of the client, why would I choose online counseling? It's going to be either for convenience. I need the flexibility in scheduling or location in order to do online counseling, or I need a particular type of clinician with a particular niche. Now, either way, um, that niche is going to help you out because if a client is looking for online counseling, particularly um, just for logistical reasons, then they're going to be overwhelmed with the number of online clinicians that are available. The whole modality just opens up the possibilities. You can now see a clinician who's in a completely different city. So the reason that I got into online counseling was for a particular niche. I'm originally from Utah, and I grew up in the Mormon church, and then I left the Mormon church, and it was a particularly difficult transition in my life. And so that's something that I focus on now is other people, and particularly women undergoing faith transition. So that's a really narrow niche, but it works really well for distance counseling because that's not a niche that clients can typically find in their neighborhood. Clients who want something just, need more of a generalist are probably going to go with whoever is covered on their insurance panel. If you're trying to get somebody to pick you in the sea of online clinicians and options, it's best to speak particularly to their needs. So I would say hone your marketing into a very narrow niche, and you'll find some success there. Um, a good example in Florida in particular is Dr. Carol Clark, who's a specialist in transgender issues, um, and that's definitely a niche specialty that you can't find on your insurance list. So consider that. As far as advertising options, then that's just going to speak to a lot of other marketing campaigns. The way that we typically market is very location based. So Psychology Today, GoodTherapy.org, all those websites that we have listings on are based on your location. But that's starting to change. So it'd be interesting to see how that develops.
Okay, so I also see a Christina was chiming in when we were discussing platforms earlier. She shared that she uses Counsel. It lets her bill insurance, but the problem she's had is unreliable video. I know when I piloted Counsel, although that was years ago and it may have changed, I also ran into glitches when I was trying to use an iPad with it where some links wouldn't work correctly like they would on the computer. Let's see here. Then we have Demetria has asked, did I understand somewhere that you can do distance counseling from home space rather than just the office setting?
Yeah, as long as you can do the same amount of privacy. So, thinking about the office space, the way that we set up an office so that it's private and our clients are protected. We have our sound machines. We make sure it's a private space. Because we're trying to protect the client's privacy there. With distance counseling, you have two locations that you need to be aware of. So your own location, which could be in your office or your home. It's easy for me at home because I live alone. If you have family members or other people that you share space with, then that's a privacy concern. And then on the other end is you need to educate your client on having a private space for themselves as well. Um, you'd think it would go without saying, but sometimes you do need to specify. Don't connect from a Starbucks. Don't make sure that you have privacy. So, for example, I have a client I see now who lives at home with her family, and so we just make sure to schedule times that her family's at work, so that she has the privacy that she needs. There's just a little bit of those considerations. But yeah, doing counseling from home is fine as long as you can have the same privacy measures that you would in the office.
We've had a few people say they're still having problems with the link to access the slides. I know like some people are saying it's trying to get them to pay $7 a month for a Prezi account when they do it. For me, when I put the link in there, I'm able to see it perfectly fine without any problems, but we're getting some comments about that. I wonder if, would you be open to creating the PDF export from Prezi and then sending us that, and I can get it out to the folks who are having a hard time accessing them?
Yep, I can absolutely do that.
Okay. All right. We also have a question from Peggy who asks if you offer supervision.
I do. Yeah, I'm a qualified supervisor. And that's a whole nother world as supervision in via distance. And Florida does allow for distance supervision for half of your supervised hours.
All right. And Angelica asks if you need to be certified to do distance counseling.
So that's another state specific question. So in Florida, the answer is no, you don't have to be certified. Some insurance companies will ask you to complete either one of their training protocols for distance counseling or ask you that you have a specific certification. And in other states, like I mentioned before, Arkansas does require training, but not a specific certification. So it's similar to any other sort of certification issue. I think of like the Gottman certifications for couples counseling. You don't have to have the certification in order to practice from a Gottman perspective, but it can help. I see certifications as a helpful marketing tool. They communicate to your potential clients that you have this specific specialty and training. So I would say if distance counseling is something that you want to be a big part of your practice, then I would I would encourage you to look into certification for that communication to your clients piece.
All right. Peggy has asked if you can provide us with your contact information.
Yes, I think I put that over here. Here's my email, Tanya@evolvecounselingcenter.com. That's usually the best way to get a hold of me. As Aaron can tell you, I don't often answer my phone. So.
We have an attendee who would like to remain anonymous, but has said that they have been doing distance counseling for years, maybe 15 or 20, both
Wow.
across state lines and internationally, and hasn't really thought twice about the legality of it until recently. From a business perspective, it's been great as the attendee has been able to market themselves worldwide. But now I guess people are increasingly becoming aware of the need to think about the legality and the ethics of the situation. But if those things can be figured out, this can be a great opportunity to expand practice and also diversify practice a bit, I would think.
Oh, absolutely. Yeah, I think there's so many possibilities. It's just a matter of regulations and government is one of the slowest institutions, and technology is one that moves really, really quickly. And so the two trying to work together, I think there's going to be these disconnects for a long time, and that leave us, the clinicians, having to be navigating between those two. We're going to be in a gray area for a long, long time.
It's no wonder that there's a lot of confusion with people at this particular issue.
For sure.
Demetra has said, what about documentation and notes if from home when privacy is not an issue?
I'm not sure that I understand the question. Can you tell me, like, what is the concern about notes?
Yeah, I'm not sure, Demetra. If one option would be we could unmute you and you could explain the question a little bit more, or if you prefer, you could type some clarification into the questions box. Maybe let me know by typing into that questions box if you'd like to be unmuted or not. I was wondering if it's maybe a question more about, well, if you take, like, say, paper notes or something like that, where would you store them at your home? But we're going to go ahead and unmute as soon as I click the right button to do that anyway. Let me set that up real quick here. Why is it not letting me do that? It's kind of odd. That is very strange. I've never seen it do this before. Maybe if, Tanya, would you be open to, well, actually, let me do it this way. I'm going to go to attendees. Sorry, folks, I'll figure this out. I think I just realized what I was doing wrong. Yep, now we'll be able to do it. Okay, Demetra, I've just unmuted you.
Okay, Aaron, Tanya. My question was, if using the home environment is safe, there is no interferences, there's no one else, it's privacy. As far as documentation, though, you have to have a chart with you, you have to do notes somewhere. If you're not in the office setting, that was my question. Is it safe to have that and do that at home, or do you carry it with you mentally? What is it that you do?
Oh, sure. Okay, good question. So, I use an electronic health record, Simple Practice. So that means that I can access my entire case notes, everything that I have from any device. I don't use any. I have a completely paperless practice. So that's probably why it didn't occur to me. Yeah.
Okay, I'm sorry. Some of us still use
that's totally fine. Yeah, it's whatever works for you. So then, in that case, you would come back to the HIPAA regulations about privacy. So that would be up to you if you wanna carry the paper documents home. You just need to make sure that they're covered. You know, you don't have it's not a pile of papers that you're gonna leave on your car seat with a name showing. You know, that it has those two locks. So so if you had those documents at home, just having a locked file cabinet would be complying with HIPAA standards.
Yeah, it's, I mean, I work with psychiatry also, and I know people have a tendency, and when working with a group from office to office, some people have a tendency, they carry the files in the briefcase anyway, because it's the only way to have the information of the patient, you know, from place to place where you go to see. So, you know, they're really not, you know, it's not really 100% secure, so to speak. I mean, you know.
Sure. Yeah. It's not. So that's an area where I think moving to a cloud-based or electronic-based healthcare system would probably be safer.
Yeah, my understanding is if you were storing files in your home, then the files, when you don't have control of them, they need to be double locked. So that would mean, like, if you left home, for example, that your house is locked, that's lock number one. And then maybe you have a locked filing cabinet, and that's lock number two. But the other issue is other people living in your space and how easy it is for them to access things, even though you trust them. It's just like on your, if you have a practice management system, a lot of people will save their password so it automatically populates and they don't have to retype in their password. But does somebody else have your password to get into your computer? And in theory, could someone easily access it? Those are some of the ethical questions that arise for people.
Yeah, no, I understand. Yeah, I understand all that. And it's not really keeping the files at home and leaving and just have them, you know, sort of in the open or unprotected. It's a matter of, is it okay to even bring it at home and do this at home and then transfer it? Even in the transfer, there is a lack of privacy in a sense. I mean, you can be in a car accident, you know, anything.
Oh,
And people are
absolutely.
doing this all the time. You know, people are doing it all the time. I mean, I talk
Ah,
to.
I think I can answer that question, Demetra. If you can transport client files, but what I do is I have a locked case. So it's a combination locked case, and that case is in my hands. And so if I get into my car and I go driving somewhere, then the issue becomes, well, what if I stop by somewhere on the way home and then someone breaks in my car? Actually, this has happened here in Florida, where a healthcare practitioner has client files in their car gets broken into, the files get stolen, or the laptop with client records gets stolen, or that sort of thing. That certainly happened here. So the issue is somebody would have to go through lock number one, which is my car lock, and then they'd have to go through lock number two, which is the case lock, in theory, to get the records. So it's not illegal to transport files back and forth as long as they're securely locked. And not easy to access. That doesn't mean that everyone wants to do it or that everyone feels comfortable with it. But my understanding is it's legal to do.
Right. So you would have then the case would have to be of transferring would have to be a lock also. Yeah.
Yeah, I actually went into Amazon and typed HIPAA compliant locking case, transport case, and they actually have them on Amazon. So, and they're not terribly expensive. Now, I kind of laugh at it too, though, because I look at this locked case and I'm like, yeah, it looks really secure, but the reality is one screwdriver and you could sucker open pretty easily. But you know what? That's also true for your filing cabinets in your office. So
yes. It's very tricky. Yeah, all these things are very tricky. There is not, I mean, there's always a way around, as opposed to when people want to accomplish something or break into something. So
Sure. Although I really think that the HIPAA issues that I can think of happening are mostly accidental. Um, aside from maybe contentious divorces, I don't think there's a lot of cases where somebody is intentionally trying to access the records of somebody else. A lot of times it's just accidental stuff. I'm thinking of like that time that I was at a cafe and sitting in the outdoor space. I looked in the window to the table next to me, and I could see it was probably a doctor or nurse. Somebody had pulled up their EHR and then gotten up to get a drink or something. So there's a computer I'm looking at, and I see all these patient names and on a schedule.
That's highly inappropriate, yes.
Yes. But stuff like that, if you don't think about it, he probably just went there to have a cup of coffee and finish up notes and didn't even think about it. That type of stuff.
Yeah, that's being completely absent-minded. But yeah, that is, I don't know how somebody can really just forget about that. That's a little, yeah.
Burnout, you never know.
Yes, indeed. Yes, indeed. Thank you, Tanya.
You're welcome.
Thank you.
All right, so I'll go ahead and I will go back and re-mute you, Dimitra. Thank you for your question and for your clarification. The next question is from Sarah, who is asking, is G Suite encrypted?
Yes, it is. You do have to make sure to go and download and sign the BAA, which is the, I don't remember what it stands for right now. Business Associate Agreement, that's what it is. So any software, any company that you use, so Google or Simple Practice, anything will have a business associate agreement, which is a document that certifies that they will maintain HIPAA standards with your client's protected health information. And so just for your records, it's important to have the BAA for any of on file. So just a copy of that downloaded for any program that you use, and G Suite provides that. And so does Doxy and VC. Any of these software companies that I mentioned, so should provide a business associate agreement that's signed by both parties.
That's a great point, Dr. Johnson. And something that I've discovered is that there are people who will use a HIPAA or HITECH compliant platform, like say Therapy Notes or Hushmail for encrypted email. But then what they'll do, or even Doxy for that matter, but then they fail to go the extra step and sign the business associate agreement. So they think, well, I've subscribed to something, I'm paying for it, I'm using it, it says it's HIPAA and HITECH compliant, but they don't realize that they're not complying with the law because they haven't yet physically signed that business associate agreement. So they think that they're legal when they're not. Could you tell us a little bit about the business associate agreement and what it's there for, what purpose it serves?
Sure, yeah. So it's part of this HIPAA accountability, where the whole purpose is to protect your client's health information. And so if you're using a third party service like G Suite, you're sending that protected health information through that third party. And so the third party needs to also certify and have a specific contract with you that says, I am going to protect this information according to HIPAA standards. So you're creating an agreement between, say your private practice and Google or G Suite to say, like, we're going to handle my patient health information in accordance with HIPAA. So without that contract signed, yes, the nuts and bolts of it will still be within HIPAA, but technically you're without that contract signed. You could be in breach of HIPAA.
Yeah, and I understand part of the signing of that contract is that that's the way that the business associate, the other entity who's providing your platform, is saying, here is what my responsibilities are, and here's what I have to do in the event of a breach of healthcare information. So without that contract, there really technically isn't such an agreement in place.
Right. So it's kind of assigning, responsibility for each of these pieces.
We have a question from Peggy. Is there a need for an addendum to our liability insurance for TMH?
That again, it's another gray area where you can request that, but I'm not aware of any laws that require it. It's a good idea. I would definitely, you can add a rider, similar to as an educator or as a supervisor, you can add a rider to your liability insurance for telehealth.
Okay. Barbara has asked the question, does the free version of Doxy allow you to download the business associate agreement? I've discovered that the free account of VC, I think VSEE, will not give you that document. VC told me that the free service is not HIPAA compliant. What is your experience?
Right, yeah. VC used to be HIPAA compliant with the free service, but that changed. So that's another reason, yeah, you need to keep on top of things. Doxy, the free version does have a business associate agreement. The paid version just provides more features, but that could change. They might
Yeah,
start.
I've always been interested in how does Doxy make a living?
Right, yeah, because they don't have ads. They don't, yeah. I imagine it's from the paid clinic accounts.
Oh yeah, like if you want to have more than one person in on the call,
Hmm.
more than two entities, then I know you have to pay for a
Hmm.
subscription.
Yeah,
I'm
even
going to
other services like share screen or. Mhm.
yeah, I'm going to unmute Demetra again. She has another question.
Okay.
So
Uh,
Demetra, you should.
yes,
There you go.
yes. I wanted to clarify a little bit regarding emails. I have Gmail.
Mhm.
I have two Gmail and I transferred to make one a little bit more professional. But my question is, I don't put anything, and I tell my clients don't put anything personal in there and secure. But they want often for me to send them like information, educational stuff,
Mhm.
things like that that I like to share, videos they like to watch, and
Mhm.
those things are relatively safe, right? I mean, what do I have
Yeah.
to put anything specific on there?
Um, Now it's up to you. There's a few options there. You could, like I mentioned before, put in your informed consent, a little clause about you're giving me permission to email you outside of a HIPAA secure platform. Um, you could put a disclaimer in your signature, similar to how lawyers do, that say, this is intended only for the recipient. If you receive this by accident, please shred it right away.
That I do.
Delete it
I
right
already
away.
have it automatically.
Mhm.
I have that one automatically.
Perfect. Yeah. What it sounds like though is, if you're sending educational materials and such, that's not considered protected health information. So, if you were sending them a copy of their intake paperwork or a bill that includes a diagnosis, then that is protected health information that would need to be sent in a different way,
Mm,
unless they gave you specific permission.
okay, yeah, no, no, not any such that. It's just sometimes they say I'm doing well, I did my exercise or something like that,
Hmm.
and I'm trying to really restrict myself from being very specific. I try to keep it as
Hmm.
general. I do tell them, do not put anything there to
Hmm.
that's confidential to protect them. So I just want to make sure that the confidentiality I do have.
Hmm.
I don't have though. I don't have though. The other disclosure you mentioned. What was the second part you mentioned besides the?
And the technology, there's a technology informed consent is a good idea, but that's if you're using online counseling. Um, the Yeah, what did I mention? Putting in the informed consent, a little clause that says I'm giving you permission to contact me via text, via email that may not be HIPAA secure. Yeah, so it's just kind of
Okay,
any.
yeah, that one. That needs to be like separate in addition to the.
You can add that. I have that just as part of my informed consent document. So, everything else that needs to be included in the informed consent, and then I just have at the end, sections for initials. I give you permission, and you've probably seen that at your own doctor's offices that ask for permission to contact you. They ask, can I leave a voice message on this number? Is it okay to email you on this? And that's for that reason.
That's in the written paperwork that I have in the office. Yes, and they do sign all that. I'm just
Mhm.
referring mostly to the email now. If I of going
Mhm.
back and forth a little bit, information that
Mhm.
may be saying I'm
Mhm.
feeling better or I'm doing this and that,
Mhm.
so that we're not in violation of anything. So.
Yeah, the way you described it, it sounds like you're complying with HIPAA.
Okay, okay. Thank you again.
Mhm.
All right, Demetra, I will go ahead and remute you.
Did you mute yourself, Aaron? I'm not hearing anything. I'm not sure.
Oh, I'm sorry. That was my fault.
Okay.
I forgot to unmute myself again. I do see a hand raised by Sarah, but I know sometimes people accidentally raise their hands. So Sarah, did you intentionally raise your hand, or if so, it looks like you've entered something into the questions panel. So oh no, sorry. Okay, great. I'll unraise your hand then. I don't see any other questions right now. I figured just for the fun of it, I'd show you guys. Here's an example of those HIPAA compliant carrying cases. And
That looks very
actually,
official.
doesn't it? It makes me look like a big nerd when I carry it around, but it's legal. So,
Sure.
but actually what happened is the first time I got one, I accidentally reset my lock combination by goofing around with it and
Oh, no.
couldn't get into it. So I broke into it with a screwdriver. And that's how I know it's really easy to break into them actually. And I had to buy a new one, but they're pretty cheap online. I don't see any other questions right now. Oh wait, looks like we're getting something coming in. Michael, is the PDF for the presentation available? So Michael, what will happen is Dr. Johnson will generate the PDF, and then we'll be sending a follow-up email to everybody who has completed the post-webinar evaluation form. And we'll include the PDF in that follow-up email that we send you along with your certificate of attendance. So just make sure you fill out that evaluation form, and then you'll get that in the follow-up email. We have a few people saying thank you very much. So if there aren't any other questions, I'll give you guys a few more announcements and housekeeping to start wrapping things up. But if you come up with a question while I'm blabbing here, then feel free to put it in, because we do still have some time available if you'd like to take advantage of Dr. Johnson's expertise. So just a friendly reminder to complete that webinar evaluation form, which will appear on your screen after we close the webinar. If you miss it, you'll have a second opportunity, as a link to that survey will arrive in a follow-up email that we'll be sending you in about an hour. Please complete that form in 6 hours so we can input your CEU information into CBroker tonight. And if you have any questions after the webinar, please direct them to me. You can email me at anorton@flmhca.org. That's anorton@FL as in Florida, MHCA as in Mental Health Counselors Association.org. We hope to see you all at our next webinar, which is entitled Unsilencing the Voice Within, Expressive Writing as a Therapeutic Tool, on Friday, August 24th from 2 to 4 p.m. Eastern Time. For more information, visit fmhca.org and click on Career and Education. I'm also hoping I'll see some of you next week at the American Mental Health Counselors Association annual conference, which is going to be right here in Florida, in Orlando. So hopefully I'll see some of you around then. A few people are saying thank you. And some people are asking about the certificates. As long as you complete the evaluation form, you will receive a certificate of attendance. And more. So here is one question. Amy would like some clarification. If you are on vacation in a different state, do you provide distance counseling to your clients in the state that you are licensed in?
My answer is yes. That's technically what I'm doing now, is I'm living in Washington State, but my license and practices and clients are located in Florida. So the location of the counselor, my understanding is not the important piece. It's the location of your license and the location of your client.
All right. So it looks like that is all of our questions. So Dr. Johnson, do you have any parting words for us before we wrap things up here?
Just one more thing about that. If you're in a different location, make sure you have your time zone straight. That's been the most difficult part for me about having living in a different time zone than my clients, is making sure that we get online at the same time.
That is a really good point. Okay. All right, well then everyone, we will go ahead and conclude the webinar for today. We'll wish you all a very happy and fulfilling and meaningful weekend. Hope to see you in Orlando next week. and we'll see you at next month's webinar.
Thank you, everyone.